So I'm Alma McCormick, and a member of the Crow Nation here in Montana. And I am involved with the Patient Advisory Committee. And I just like to share a little bit about my experience in working with my people, the Crow people, on the Crow Indian Reservation, and why trust is so important. So many of our people are afflicted with diabetes. And so I'd like to share a story here from our last research intervention. This person shared that as she was going in to see her primary provider, she described this provider sitting there with her back towards her in front of the computer screen. And so she was just seeing the back of this provider. She shared that that's just the way it was. And it was very casual and just basic questions and you know, prescribe, refill her prescription, and that was it. And out the door she went, and that was how she described her relationship when she would go in to see her primary provider. And so as she took part in this, and what we've done, not only in just this last research intervention, but from the very beginning, when we began to just reach out to our Crow women with this approach of a messenger, a lay health advisor, someone they know, someone that they can trust, someone that they can relate to, was providing just basic knowledge about going in and having a Pap test exam to prevent cervical cancer. Those were our early stages. They had to see that we were there and we were going to stay there, and what we said we were going to do, we did. So it took time. Building trust takes time. And when you want to build trust, you listen with your heart. Listen with your heart. And so what happened in this story is the information and the tools that this participant received, because she trusted us, the organization, she took these tools, applied it to her life. Pretty soon the provider turned her chair and began to interact with her. And now she was able to express to her provider, to have conversation with her. And it shifted. And now there was a rapport that is so important to have. And that's what really caused her to begin to take better care of herself, to feel that she could tell this provider what was really going on with her. Now this provider is facing her, and they can have an interaction. They can have a relationship. There's trust there now. They can build on that. And so that's what this individual shared. She shared her story. See, it's stories, you know, that's really powerful. That's what this intervention was really based on too. And that's storytelling. We based it on our culture and who we are as Crow people and how we relate, on our values, on our kinship, on our clan system. And that's how we built this intervention, as we reached out, as we invited and recruited people to take part as research participants. And this story I just shared is, to me, is kind of one of the latest examples. And what a shift in that relationship, when there can be trust, when someone can feel that this is, yes, I trust this organization. I'm involved in this program as a research participant. That's what community-based participatory research can do when it works mutually and respectfully between research partners and the community partner. Me as the community partner, and how my people have trusted me because they know what I've been through, the experience I had in losing a little twin daughter to cancer, and how I reacted to that experience. Even though my little girl passed away It puts such passion in my heart that I want to help people. I want to help people. If I can do anything to help my people, I'm willing to do it because it comes from my heart. And again, it goes back to the heart. I can never leave that out. Passion from my heart in the work that I do, passion from the hearts of our medical providers, and even the heart of the people that we reach out to. It has to come from your heart. It's heart to heart when you want to build trust. And that's what I'd like to share. And thank you.
Visit buildingtrust.org to learn more